In this presentation, I'll be talking about the diagnostic process of cutaneous melanoma. Cutaneous melanoma is a specific type of skin cancer, and melanomas alone account for roughly 1% of all skin cancers. Recently, the amount that this cancer has been diagnosed has been increasing, and it accounts for the most deaths. In 2020, 6,850 people alone are expected to pass away due to melanoma. If individuals are aware of certain aspects or methods to educate themselves on what can be noticed of melanoma, then this can be taken care of. The most common way to notice melanoma or bring attention to abnormalities in your skin is the ABCDEs of melanoma, which is a visual inspection. And this method is an acronym. A stands for asymmetry, which you are looking for skin spots that have abnormal or asymmetric growth to them. For B, you're looking for irregular borders that aren't like the rest of the moles on your skin. For C, you're looking for color variation, whether that's more than one color or a shade of the same color. And then diameter, you're looking for skin spots that have roughly the size larger than a pencil eraser, which is around 6 millimeters. And then for evolution, you're looking at skin spots that have evolved in size or thickness. And in order to bring attention to that last one, you do need to do this often. And then while this is a good starting point, it is not exactly always accurate, and this is because certain melanomas can lay outside of the parameters of this. So if abnormalities are found, other procedures and actions need to be taken. One of the other actions that can be taken is to see a dermatologist. Dermatologists are trained professionals that can catch melanoma in the early stages, and they are an essential part of diagnosing melanoma. They can help you prevent this disease from the get-go, and they can also help you determine your risk factors. So those who are at an increased risk of this cancer are usually those that are fair-skinned, have lighter color hair, lighter color eyes, they've had excessive exposure to UV rays, or they have been sunburnt quite a bit, and those that have many moles and a weakened immune system. And with this, the dermatologist can discuss your plan of action or your course of action, and they can do a couple different procedures. One of the more common procedures is a full body exam, where they go over your body and look for any abnormal spots, moles, and they keep doing that regularly to see how they evolve. Depending on your risk factors, this should be done very regularly. And then if something needs a closer look at, they will use a dermoscope, which is part of the procedure called a dermoscopy. And this procedure looks closely at your moles, and this tool combines a flashlight with a microscope. And if anything abnormal arises from that exam, a biopsy will be taken to test. There are many different kinds of biopsies that can be taken. The most common type of biopsy when dealing with melanoma is a lesion biopsy. This biopsy takes a specific portion of your skin and it's sent to the laboratory for further testing. And based on what type of lesion biopsy you're having conducted depends on the size of the skin sample that is taken. So a shave biopsy takes off the least amount of skin. It takes out the outermost layer of your skin with a scalpel. A punch biopsy goes pretty deep into your skin and cuts out a bigger portion of your skin. Once that skin sample is removed, the incision does need to be closed with stitches. And then the excisional biopsy removes the entire suspicious skin, whether it's a mole or just a color spot, no matter how big it is. The excisional biopsy is the most invasive procedure, but it is also the most common because it will remove all or most of the cancer in one procedure. And knowing all of this is very important because melanoma is an extremely aggressive disease. If you are not aware of these procedures or how to identify abnormalities, it will allow the cancer to metastasize, which is where it spreads to other parts of your body, and it will not be able to be easily treated. This delayed diagnosis is responsible for the high mortality ratings. So, if individuals are more aware of what to do to catch the disease, then the mortality ratings will lower because cancer will be identified earlier and it will be able to be more successfully treated. And then the bottom has all the sources that I used.